Hi, my name is Sally Paini. This is part of my practical assessment for my study with AIPT. This section is about special populations that we might come across as a personal trainer and what those conditions involve and how to modify exercises. The first special population I wanted to talk about is a client that has high blood pressure. Higher blood pressure is a condition that occurs when the blood is pumping with more force than normal through the arteries. This added stress on the arteries can cause clogging of the arteries, which in turn puts fatty deposits and causes serious conditions such as heart attack and stroke. Hypertensive clients that are on medication already can experience post-exercise low blood pressure due to their medication. They can have increased fatigue and lethargic behaviour, or even a lowered cardiovascular response during the exercise. It's important to manage this risk by avoiding high variability in workloads, avoiding high intensity interval training where the blood pressure can vary significantly. It's also important to ensure the client has a long warm-up, longer than normal warm-up, and then a longer than normal cool-down to bring the body back to normal. Exercises can be modified to take the pressure off the chest area and the heart and reduces stress on the heart as well. An example would be if you were to do a normal push-up, this could be modified to a wall push-up, making it a little easier for the client until they become fitter and stronger. The second condition or population I wanted to talk about is people that are experiencing lower back pain. This condition could affect almost anybody in the population. And the pain could be related to muscles or a skeletal issue. It could be ongoing, or it could be the result of an injury. Exercises can be modified to reduce the load on the lower back. For example, instead of doing a squat with a weighted barbell, the squat could be performed on a leg press machine so that the machine is supporting the client's body weight. Or you could even do the squat just with body weight, perhaps like up against a wall or using a football for support. It would also be really important to improve the client's core strength, which would in turn help support the lower back area and hopefully helping to reduce their pain. The third population are people with knee injuries. These are very common. They could be a result of sport, such as netball or running, or again could be a motor vehicle accident or something they've always had. It's really important to that any poor technique is picked up and corrected to make sure there's no further damage or pain from completing those exercises. An example of this would be to really make sure the knee alignment in a squat or a lunge is correct so that the knees are not falling in or being pushed out too much and putting extra pressure on the knee joint. It would also be really great to work on exercises that would strengthen the muscles around the knee and help support that joint and prevent any injury going forward.